Hello and welcome to part 2 of our discussion about stem cells and all that they do. We're here with John R. Roland, MD, again, who is, of course, on the board of directors of the American Association of Stem Cell Physicians. How are you, Dr. Roland?
I'm fine.
We talked so much about stem cells and a little bit about the background of what they are, how to get them, all of the applications, but I know we wanted to dive a little deeper into how they're used and the expanded role of the stem cell. Can you talk to us a little bit about that?
Well, that is particularly my interest in stem cells. It was always a curiosity of mine, not only that these stem cells can turn into so many different tissues, but how it affects so many different processes. And for a long time, we really hadn't known how they worked. I happen to be trained not only in stem cells, but in functional medicine, which really is a very intense study of the pathophysiology of what is wrong, let's say when you have MS or rheumatoid arthritis or lupus or any of these degenerative diseases. And so stem cells, as we'll learn, play a central role in the immune system and can affect these other dramatically different diseases all across the board. So that's what really lured me into stem cell medicine, to be honest.
And I know so much of this is so cutting edge. Can you talk a little bit about inflammatory disease and how stem cell therapy and stem cells are changing the game?
So in the first segment, we were talking about how with today's application, it has so many applications about arthritis. And we incidentally noted that it would help with other diseases, systemic diseases all over the body. And so the question was how and why. This is more than the stem cells just helping cells recover on a cellular basis. So as it turns out, the reason why we get inflammatory diseases, inflammation really is the immune system getting triggered and getting hyperstimulated from a variety of inputs. And it is this immune system that ends up scarring the body. So even arthritis, and I think this is a great example. When I inject stem cells into a joint, some of it is wear and tear. But frankly, what happens in arthritis is that your immune system is hyper-stimulated. And it is the white cells and the phagocytes and the lymphocytes and the monocytes and all of these parts of the immune system that are literally attacking the joint and melting the cartilage. So wear and tear plays a role, but it is this involvement of the immune system. So here's the miracle of what stem cells are doing and why potentially it can be used in so many, 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 many diseases. When I inject stem cells into a joint, it's arresting the immune system. It's stopping the degradation of the joint and allowing then the stem cells and other parts to regrow the cartilage. So now we have a mechanism. It is intervening in some very key players and very key parts of the immune system. So inflammatory diseases certainly play a role in MS, in multiple sclerosis, for example, and lupus, and rheumatoid arthritis, and psoriasis. And individually, we are seeing responses in some of these diseases with the use of stem cell. And as we look at the larger role, even diseases that have to do with scarring, like granulomatous disease, like sarcoid, we may have a role with stem cell treatments. Now that's yet to be discovered, but now we have a model. And now we have a mechanism by which this has an impact.
there's so many moving parts, and it can get a little, it's so interesting and so deep and a little bit confusing to some of us, I think. Can you give us, I know you kind of touched on a couple of examples, can you give us another example of a way that this is really treating some of these, inflammatory diseases? And is it treating this?
Yes. So psoriasis is kind of a scaly reactive skin disease. This is not something that I can guarantee a treatment, but for instance, there is a case study, which means one patient treated. But this is a patient that had psoriasis and had been treated with steroid creams and all of the topical things.
Sure.
That didn't work. This is hyperstimulation of the immune system, and so was then given immune modulating medications like Humira and some of those things that you've heard about on TVs. He didn't respond to those either. And he eventually received a stem cell treatment, intravenous stem cells, and his body-wide rash that was scarring the skin resolved within a month and has been pretty much symptom-free for the whole year.
Wow.
And we're still monitoring it. I talk with the doctors that treat him. And the fact is that it is effective in psoriasis when so many other treatments weren't effective. So this is a new theory and a new way of adapting these stem cells. And it's fascinating to read and to study and to potentially try in patients.
Absolutely. That's just one example of how this research is so cutting edge. And I know you talked about it in our first segment a little bit, but maybe we could dive a little deeper into anti-aging and how stem cells can be used in that regard.
So, yes, anti-aging is it's almost, tongue-in-cheek that we would even be saying that.
Right.
But there was a researcher that presented studies at this conference. They were originally treating hearts, and they were injecting stem cells into the hearts and getting some response, getting some rejuvenation, some recovery from injury for these heart conditions. And then, curiously, they went in a totally different direction. They treated elderly patients that were starting to get frail, and they were just using general discussions, general measures of frailty. And they took, and not only that, but they took stem cells, bone marrow cells from a donor, and they injected it intravenously into these elderly people to see if they could get anti-aging reduction in frailty, something as broad as that. Now, I'm not saying that they jumped out of bed with improvements, but they did measure improvements in these elderly people. They were more spry, they had more energy, they had more vitality, and these were actually measured. So there were several things that we drew from that. Not only that, it does have some effect in anti-aging in elderly for this broad category, but that using donor cells from another person injected into that elderly person was safe. And we even learned some things about dosing. They measured, they injected 30 million cells, which kind of sounds like a lot. It's not. Yeah. It's a pretty common dose that we use. And they measured the response of 100 million cells. And then they measured the response of 200 million cells. And guess what? The people that respond the most were the ones that got 100 million cells.
So right in the middle.
That's right. And so now we're starting to we're gathering data about proper dosing, which is, again, something really new and really fascinating about this. This is the first time that we're actually talking about dosing of stem cells.
Wow, that's incredible. And I know this conversation is on the heels of where you were as a speaker at this national conference. Can you tell us kind of quickly about that conference and what else you learned was really available now?
Yes. So certainly we can treat arthritis, and we can treat back disease and chronic illness. We can treat eyes with certain vision problems that are starting now to come forward. This is highly experimental. Outside of treating with joints, which are pretty well recognized, these other applications we're learning more. Right. And so You may find a doctor that is able to treat you, like coming to see me, but you have to understand that we'll review all the data out there, and we'll have to recognize that this is highly experimental as we go to these more rare conditions. We're just still learning. We're learning not only from our colleagues here in the United States, but we're learning from other doctors that are practicing this around the world.
Yeah.
We're learning things about dosing, like I just mentioned.
Right.
We're learning things to measure the response of the immune system. And there was a very interesting study treating kidney disease, and I mentioned it last time. But we injected these stem cell products, and we were able to measure measurable cytokines. These are inflammatory molecules in the individual, in the patient, and we could see response, and we could see that it lasted about a year, and then the response started to fall.
Okay.
And so that's giving us information that, we are needing to repeat the dose about this time. Another something that we haven't ever been able to get. If I get stem cells and they respond, when and if do I need to repeat it? We haven't had anything to go by. Now we're starting to develop real knowledge of when we might need to repeat the dose.
Right. So you're gathering so much knowledge, like you were saying, for the current and the growth, and it's in motion right now, gaining speed. What do you think the future holds?
Well, that is also part of our central theme, and it came out of the discussion with the board of directors. We are going to be embarking on a number of measures, not only teaching doctors how to practice this, but how to practice safe. We also are going to be working really hard in developing methods so that we can collect the data and we can provide them what's called an IRB, an independent review board, so that we have that we are practicing in an ethical, proper manner to support these doctors in pushing forward the knowledge about stem cells. That's very important. The other part is that we're going to need to work with the FDA to help us mutually develop guidelines, safety guidelines and protocols. And I'm so glad that I've been named as the chairman of that committee.
Incredible.
So I'm very excited about pushing forward the safety of these practices.
So what does that relationship look like? What are some of the next steps for being a part of that board? That's incredible. Congratulations.
Thank you very much. Well, I think these physicians pulling together like this, we have some researchers, PhD doctors that have done research at Harvard. I mentioned the work that was done by the University of Miami with frailty things. Those doctors have been working with independent review boards, and I think we start to learn from them and adapt some of their practices and then provide those to some of our more common members. I'm not, for example, associated with the university. I deeply want to help involve myself in some of this research.
Absolutely.
Yeah.
But you're incredible at what you do, and I know you have a lot to do as well with functional medicine. Can you kind of talk a little bit about what that is and how this all comes together in a full circle?
So I've mentioned, for example, multiple sclerosis. And there are a number of studies showing that stem cells have an effect on MS, on multiple sclerosis. But we are learning more and more about all of the contributing causes for MS. And I'm really referring to some work done by Dr. Terry Walls. And she's treating MS, not with stem cells, but with functional medicine, which has to do with diet and exercise and stress management. And it is all of these insults that end up affecting our immune system and causes it to be hyperstimulated.
Right.
So then it ends up attacking the nerve cells in an autoimmune fashion. And then we can use stem cells certainly to affect that. But wouldn't it be better to address all of the causes up front? In a simplified manner, celiac disease is a perfect example.
Sure.
Because celiac disease is an intense autoimmune condition with antibodies that are attacking and basically destroying the intestine. We could treat it with stem cells, and I'm sure that we could get some response. But the fact is, wouldn't it be better to remove the insult in the first place, which is removing gluten from the diet? If we can take celiac patients and remove gluten from the diet, the expression of celiac disease goes away. It's really remarkable.
Right.
So that's frankly why I have a tree as a logo for my company. The leaves of the tree are the conditions that we treat: chronic fatigue, MS, lupus, rheumatoid arthritis. All of these are just a collection of symptoms, but they don't tell us what's really wrong.
Right.
The roots of the tree have to do with diet and stress and association with things like insecticides and pesticides and the things that we raise our vegetables in, and artificial sugars and a stressful lifestyle, and even things like having unhealthy relationships all affect the organism, the complex organism of the human being.
Right.
And we can change the course of something like MS or even dementia. Dale Bradison has done some work from UCLA reversing the cause of dementia by addressing all of these causes in the roots of the condition.
Sure.
Yeah.
So many moving parts that find out what makes us tick and come together as a human, right?
Yes, yes.
Unbelievable. Well, we were just talking, you were just talking a little bit about your company. If people have questions, what is the best way to get in touch with you, and what is the best way to find out more information?
I do have a website, and I have an office, and we'd love, again, there's so many parts that to chronic disease that really the proper thing is to set up a consultation with me so I can really spend time with you and go in depth about what's going on and what we could do. And my website is evolutionmedicinedallas.com, and certainly you can share with me your email and your questions. We can even set up an appointment that way, and I'd love to set up a free consultation with you.
All right, that sounds great. Dr. Roland, thank you so much for joining us.
Thank you.
Yeah.